So actually this story of Husna should, be the reason that Nigeria will start believing in our system, in our hospitals, in our medics. We can do it. We can't thank, Nizamia enough. I think they have justified the confidence we've always reposed in them. And for us, the fact that Husna is alive today, is a testament, a very loud testament, to the professionalism, of that medical outfit. It's quite emotional, but I think that this is a blessing to humanity.
I didn't know anything. Actually, I was just having like small pains. It was my first time. I didn't know anything. I was just home. I said, maybe it's typhoid. I don't know. I went to hospital close to my house like a week before. I told the doctor, she said I should just have a rest. I should be resting. She said I should observe for 2 days. After observation, I said, should I call her? Should I not call her? Let her know, say that I'm bothering her too much. I complain a lot because that night I couldn't sleep. I thought that it was the babies moving actually. I couldn't sleep. In the morning, I called her. She asked me, when is paining you? Is your tummy getting strong? I said, I don't know, because I don't know what it is. Yes, it's my first time. I just have after hanging up the phone, it has started again. And then I touched the tummy. It was very strong. I called her back. She asked me, where do you want to give birth? I said, Nizamia, of course. She said, okay, rush there, you are having contractions. So as we were going, I was still feeling bad, having pains. Me, myself, at some point, I started willing that, okay, it's better these babies come out because the pain was unbearable. My back was paining me so much that I was hoping that, okay, if they can come out but survive, then I will be happy. At last, the doctors now came. They were following me. This one will tell me, okay, there are chances that you will have them, but still we are going to do all we can. And it's what they did. They tried everything they could to keep the babies. At last, they just told me that I'm already I was bleeding. So they said that we have to remove the sacrilege and then proceed.
At that point, my preference was to have herself first, and then talk about the babies later. Because of course, what was paramount, in my mind, and indeed of the doctors, I'm sure, was to save her first. So when she was saved, we then now focus on the babies. They came out 3 of them because she was the smallest. Her 2 brothers that left her were much bigger. After a while, I think a couple of days gone past, we lost the first one. Okay. It was expected at that age. You could expect that, unless miracle was to happen, like in the case of Husna, you're going to lose them. We lost the first one, we buried him. We were hoping that at least, the two will survive. We lost the second one again. At that point, I said, well, I think the game is up. In fact, I was looking beyond her. Each time I got a call from the hospital, whether from, the doctors or anybody, I was just expecting the worst.
I would like to thanks for my friends built this hospital 11 years ago with high-equipped ICU and neonatal ICU. Especially neonatal ICU is very, very important for Nigeria because the baby death rate is very, very high in the world, but especially in Nigeria, we have biggest problem.
Ideally, a smooth ride should be baby getting to term and delivered. But prematurity occurs worldwide, and it is pretty common in our environment. Many factors are responsible for that. Some factors are to do with the mother herself, having some background problems, some diseases, hypertension in pregnancy, diabetic that is poorly controlled, heart disease, anemia in pregnancy, some stressful conditions. All the problem could arise from the placenta that attaches baby to mother, or sometimes could be problems from the baby itself. And in this case, for example, we had a situation of multiple gestation, having 3 babies, managing a small space, and then with some other triggers that could push the mother to deliver prematurely.
Clinically, we are dividing the babies to 2 types, premature babies and mature babies. So mature babies are after the 36 weeks, and premature babies also we are classifying to their weights. Under the 1,000 grams or 1 kilo, we are classifying or defining them like extremely low birth weights. Less than 1,500 grams, we are calling them very low birth weights. More than 1,500 grams up to 2,500 grams, we are calling low weight at birth. So in our case, our babies was extremely low weight birth.
This baby was born at 23 weeks of gestation. For us and for family is very difficult condition. The baby's condition was very bad. Baby was intubated immediately, and we placed on the mechanical ventilator. Baby stayed in ICU for 4 months, and at birth, baby's weight 600 grams. 1 week after birth, we did echocardiography. Echo showed congenital heart disease, PDA, patent ductus arteriosus. Yes, patent ductus arteriosus is commonly seen in premature baby. Yes, and the treatment of PDA is usually very successful with drugs. Yes, but in some cases, baby it may not respond to treatment. Unfortunately, this baby medicine did not work. Yes, after 1 week, we checked again. We repeated echocardiography. Echocardiography showed no change. But after 3 weeks, we did echo again. Echocardiography showed signs of heart failure, poor feeding, fast breathing, and baby symptoms. And the baby couldn't tolerate mechanical ventilator. Yes, a cardiology doctor and cardiac surgeon together decided to do operation.
I think I was in the hospital. She called me, and Dr. Lukman suggested that, somebody was in town, a specialist who, did some operations on, some patients where he was in town, and that he suggested if he could do the operation on her. Open heart surgery for a girl like that, I couldn't just wrap it around my head. But what option did I have? I mean, none. It's at that point it was a do or die thing. I said, okay, we should go ahead. They brought the papers. I couldn't even read them. I just appended my signatures to it. If that, was going to help, salvage the situation, why not?
Please come ahead, me hand. What's your name? I want to the back of the baby so that.
I'm so happy for the baby because I followed very closely. I watched the surgery, live surgery, and I saw the improve of the blood oxygen level after the closed the PDI. Maybe simple procedures, but in Nigeria, you cannot find any doctor at that time to make this surgery.
After the operation, yeah, baby was getting better every day. Before operation, before surgery, I did not hope for this baby. But after the surgery, and I felt this baby will survive. In following days, baby every weeks, baby's weight increase and baby's condition is getting better. Baby stayed in ICU for 4 months. During this period, I was sleeping in the ICU sometimes, and I couldn't go to outside for 4 months because sometimes baby's condition should be not good. Yes, respiration problem and mechanical ventilation problem. Sometimes enteral feeding problem should be problem. Mother was coming every week. But mother was crying when she came here. Was crying because there was no hope. I cannot say this baby will be okay. I cannot say this baby condition is not good. But after surgery, I told her there is small chance.
When she had heart surgery, so from there the doctors, all of them, they came to me. Dr. Lukman, that doctor that did the heart surgery, they told me that by God willing, this girl is going to survive, because that was the major issue that they were having. So, but as from there, I started having hope. Each time I meet Dr. Lukman, he will tell me that, yeah, baby is doing well. You will see the joy on his face after that surgery.
The neonatal ICU is not easy, the department to manage. And you need a high quality doctor, has an experience of the neonatal ICU, but it's not enough. Also, you need a well-trained nurse, technical person, and also the technician, because we are using the very high technology.
This baby is a very premature baby. That means that everything about this baby is premature. The organs, the lungs, the heart, the skin, the immunity, everything is so premature. So you have to take extra care when you're taking care of this baby. This baby was connected to a life support with a very tiny tube. So you actually have to make sure that you maintain a patent airway of the baby every single moment. And this baby cannot fight disease or infection on her own. So you always have to make sure that you are on this regalia, on this PPE. And then you also always have to make sure that the baby is hemodynamically stable. You're watching the heart rate, you're watching the oxygen saturation, you're watching the breathing. And also for the medications, you have to be, absolute precise, like there's absolute precision when you are calculating the medication doses for this baby, because you can't afford to make mistakes. Then for the feeding part, this baby cannot suck. So we have a tube that we inserted from the mouth to the stomach. Then we feed the baby through these tubes, and also have to make sure that we maintain the temperature, a good temperature, because as a premature baby, they don't have fatty cells to keep them warm. So our incubator right here, we ensure that we set them within a normal range to ensure that the baby is warm at all times.
It's really an amazing experience, especially when you receive her from the beginning. You have seen how tiny she was. It's just 30 centimeters. And the head is very small, like the mouth is very small. I was even saying like it was very challenging to intubate the baby at the first, because it was my first experience of seeing such a deep preterm neonate. Then by the time when she was growing and gaining weight, and so like when we remove her from life support, that's when when you carry her and keep her close to you, like, oh, you feel like it's so precious. It's amazing. It's like, there is not enough words to describe it.
For premature baby, for premature, there is one chance in this hospital. Yeah, because we have advanced technology, incubator, monitor, ventilator, mechanical ventilator, and oxygen system, very important. But I believe, and I trust my team and a hospital. I trust, and I have experienced team and nurse and other doctors.
I believe if the baby was not in a competent hands and in a facility that has everything it takes to take care of this baby, to manage this baby, I don't think this baby would have made it. This baby was in a good hand, was in competent hands, dedicated hands, people that were extremely dedicated to making sure that they took care of this baby up until the baby was discharged.
It is a game changer because, one, we know that now, whether the viability or not, as long as the baby comes alive, we'll put in our best. At least this has proven to us that probably yes, there was significant scientific consideration before you arrive at the age of viability. But once the baby comes alive, we'll put in our best, because we don't know, the outcome might be a very favorable one like this one. We have the requisite equipment, we have the expertise, and the commitment to do it. This case in question is an evidence of that commitment. Imagine having to keep an eye on a baby 24/7. There is not a moment when there is no doctor available to attend to any issue there.
I was actually amazed to see how much Dr. Lukman, for example, and his staff put in this. He was virtually sleeping on the couch on the bedroom, just to take care of these babies in the ICU. It was, I thought it was something that his professional colleagues in the public sector, in the government hospitals, could emulate, because this is not about payment. It can't be about the paycheck.
It's about passion.
It's about the passion. It's about humanity. And I think I would actually recommend this, to our medical professionals at all levels. It was amazing. Yes, God has done his will, but of course, God has just crowned people's efforts, and those efforts by Dr. Lukman and his crew actually accounted for why God, granted our prayers, and given us this miracle. So I want to sincerely thank them for this, and to say that may God be with them all the way. May God continue to elevate, the hospital.
As a Nizami hospital, we have a plan to improve our, the neonatal ICU, but not only neonatal ICU, because the many neonatal premature baby has some congenital anomaly, especially in cardiac anomaly, can cause the death in a few weeks. So our next plan, we will open the pediatric cardiovascular surgery department. Now I ordered the equipment, and I also bring another high-quality doctor for the interventional pediatric cardiology. They can do some procedures without open surgery in pediatric cases. So all of them needs the more investment or more, and also expanded some clinic. So, but as a Nizami hospital, we have a big plan for future in medical tourism, and every year we are improved our service, especially in neonatal ICU. New device, new equipments, and new technology we are bringing.
What has happened in Nizamiya, regarding these kids, has completely changed my perception about what we can do. I earlier told you I always had this abiding faith in our system. We're even stronger now. I'm sure if this had happened in Canada, or the United States or in UK, they will say, it's because in Canada that's what she has survived. But she survived in Nigeria. Not in Canada, it's not in the United States, it's not in Dubai. It's in Nigeria. What that shows, what that says to us is that if we believe in ourselves, we look inward, and improve, our facilities, we will reduce this medical tourism, this sometimes needless medical tourism that we indulge in, as a country. So for me, Nizamiya, and facilities like them, can actually lead this advocacy, for people to reduce this medical tourism. Nigeria is, is so famous, or is it infamous for?